like to thank the NFL Foundation for their generosity in making this course possible.
Hello, my name is Dr. Shauna Springer, and I'm the Senior Director of Suicide Prevention Initiatives at Tragedy Assistance Program for Survivors, or TAPS. Those who serve in our nation's military often carry a heavy burden of grief relative to others in society. In addition to dealing with loss more frequently, veterans are often impacted by deaths that look different than those that affect non-veterans. Whether fellow service members are killed in action, killed during training accidents, or die by suicide, the theme often involves exposure to sudden, unpredictable, violent deaths. For over 25 years, TAPS has been providing compassionate care to all those grieving the loss of a military loved one. TAPS is the leading organization in the areas of grief and loss, and our expertise has had global impact. In our training and consultation, TAPS uses licensed providers with strong backgrounds in treating military and veteran trauma in combination with the lived experience of those who have survived loss. The pairing of these two perspectives gives us unique insight about how to strategically support individuals suffering from the trauma of suicide loss in particular, and its related grief burden. This course will help you recognize that grief and trauma are different challenges and that they require different healing strategies. At the end of this course, you should be able to understand symptoms common to both grief and trauma after suicide loss. Describe why grief is often overlooked in clinical settings where veterans and military family members are served. And understand why it's important to treat trauma after suicide loss before treating grief. Grief can be missed in clinical settings where veterans are treated, especially after suicide loss. There are many reasons for this, including the fact that grief and trauma are hard to differentiate. Both are conditions of acute suffering with a wide range of associated emotional and physical challenges, and they have many overlapping symptoms. When a person has suffered a suicide loss, he or she might show a number of symptoms that are common to both grief and trauma. These may include intrusive thoughts, disrupted sleep, nightmares, intense physical reactions, strong negative feelings, withdrawal from others, numbness, avoidance, and self-blame. No wonder it's so challenging for providers to tell the difference between grief and trauma. There are other reasons that providers may overlook grief in veteran suicide survivors. First, many providers prioritize trauma symptoms and the diagnoses that go with them, like post-traumatic stress. Second, veterans and military family members may not talk about their grief to their providers. Those who serve in the military and their families are often influenced by a culture of stoicism. They often minimize their own pain in relation to the belief that their peers, such as those who have lost limbs, have greater challenges to overcome. Third, compartmentalizing pain and focusing on the immediate mission or the support of an active duty service member who is deployed is a priority for military service members and their families. As such, many veterans and family members may be numb to their own pain or find it difficult to describe their suffering in words. As someone who has worked closely with hundreds of service members and veterans over the past decade, I have learned that one of the greatest barriers to talking about grief, especially after suicide loss, is the perception that mental health providers will try to get them to process it and move on. For many veterans, the pain of loss keeps them connected to their fallen brothers or sisters, and the last thing they want to do is sever this connection. The idea that clinicians want them to process it and move on is a reasonable assumption, because after all, that is the goal in the treatment of trauma. But grief requires a different approach. In fact, the last thing we want to do when people are grieving is to ask them to get over it and move on. Healing requires that both grief and trauma are addressed. It is important for suicide loss survivors to feel safe in sharing their grief as well as their trauma. And it's vital that providers have a well-informed understanding of how to address grief in a healthy way, as well as how to treat trauma. Why is it important to look at both grief and trauma after suicide loss? Some emotions, for example, shame, guilt, or the horror of witnessing the trauma of a suicide, can block the progress we can make to heal from events like these. And this can lead us to remain engulfed in a pain that's not productive, as I've seen in my Vietnam veteran patients, sometimes for decades. If a survivor of suicide experiences trauma symptoms, these must be treated as a first priority. Doing this allows them to move forward in the grief journey. After trauma is treated, grief must then be addressed, allowing for further healing to occur. Addressing trauma after suicide without moving through grief into post-traumatic growth can leave us stuck. Given that grief and trauma after suicide loss have many overlapping symptoms, how can we tell them apart? There are questions we can ask someone who has survived suicide loss, all of which are covered in an extended training that is offered free of charge through the TAPS Institute for Hope and Healing. The first question is, when you think of your loved one, what kinds of images come to mind? The second question is, do the images and thoughts about your deceased loved one loop over and over in your mind, or do they change as the wave of emotions passes through? And a third question is, when you think of your loved one, do you have feelings like love and yearning, or are they more like helplessness and horror? The answers to these three questions can tell us a lot about whether the person's memories are based in trauma. If a person's memories of the deceased are violent and disturbing and related to the way in which the loved one died, this tends to indicate trauma. Where memories of the loved one physically intact are less trauma-based. If images and thoughts of a loved one feel stuck and don't change with our emotions, this can also be a sign that trauma is present. Finally, if feelings about the memories focus on themes of guilt, shame, helplessness, or horror, this indicates the presence of trauma symptoms, which need to be addressed by a qualified provider. On the other hand, when people grieve, there's often a feeling of love, closeness, or yearning that comes with the loss. As we say at TAPS, we grieve because we love. While there is some mercy in feeling numb, in order to recover, it's critical that suicide loss survivors confront both grief and trauma. In one sense, treatment for trauma and grief are similar in that the short-term goal of treatment for both is to decrease avoidance and help us sit with what we're feeling. However, as I mentioned earlier, the long-term goals for treatment for trauma and grief are very different. With trauma after suicide loss, we want to decrease the intensity of the feelings. This helps us move forward toward recovery by weakening the emotional connection with the memory. In grief after suicide, however, the long-term goal is to restore, renew, and strengthen the connection with the deceased. Healthy grief allows us to reconnect with our loved ones and carry this love forward. Knowing that the goal of healthy grieving is to enhance connection, rather than to find a way to say goodbye and move on, might allow those who would otherwise conceal and protect their grief to be able to get support for working through it. When grief and trauma after suicide loss are successfully addressed, there is the potential for achieving post-traumatic growth. My friend Mike Urgo is a perfect example of this. Mike is a Marine Corps combat veteran who deployed to Iraq during the invasion of Fallujah. He suffered many losses during his time in the military, both to combat and to suicide. Mike's survivor's guilt and grief brought him to a very dark place at one time in his life. A critical part of his recovery and growth has involved making meaning of these losses. This is a picture of the Kona Triathlon. Mike is a sponsored Ironman who competes in honor of his fallen Marine brothers. And here's a picture of another Ironman triathlon. This was taken at the end of the race, where I gave and received a big sweaty hug from Mike. What you see in this picture are the many names of his fallen brothers on his jersey. After completing a 2.4-mile swim and a 112-mile bike race, Mike picks up a full-size flag and carries it as a tangible symbol of the love he carries for his fallen brothers as he runs a full 26.2-mile marathon. It is clear to me that far from weighing him down, Mike's love for his brothers, which sometimes shows up as deep grief, is the fuel for the life he now leads and the events where he honors those he loves. This is an example of the potential outcome for anyone who has faced off with both grief and trauma after suicide loss. It's a vision for how we can heal and become stronger in the end. This is post-traumatic growth. In conclusion, we hope you'll walk away with these insights after viewing this course. Grief and trauma are equally important to address after a suicide loss. We can distinguish between grief and trauma by asking questions that are based on a good understanding of both the similarities and key differences between grief and trauma. If grief is experienced along with trauma, the trauma must be treated first. Otherwise, it interferes with progress and growth. Treatment for trauma and grief have fundamentally different long-term goals. And with the right treatment and support, we can achieve a level of post-traumatic growth that can transform us and stay with us for the rest of our lives, giving new meaning to all of our future endeavors. TAPS Institute for Hope and Healing offers a 60-minute deeper dive into this topic, which is free thanks to generous funding from the Boeing Foundation. To learn more, you can access this course, which is entitled Suicide, Grief, and Trauma, and other courses by visiting www.taps.org/suicide postvention and clicking on the link below Trainings. Thank you for taking the time to view this course and for caring about our country's service members and veterans.
The Veterans Crisis Line number is available 24 hours a day, 7 days a week. Please call 1-800-273-8255 and then press 1 if you or someone you know is in crisis or just wants to talk. If you have any questions or need assistance, go to the PsychArmor website or call the PsychArmor support line at 844-779-2427. Thank you for completing this course and taking that one step further in learning about our American veterans.